Welcome to The Explainer. Today, we're going to pull back the curtain on something many of us will experience at some point: surgery.
We are going to follow the entire patient journey, step by step, from the minute you check in all the way through to those first few moments of recovery. By the end of this, you'll have a much clearer picture of the process and hopefully feel a lot more empowered.
So here's our roadmap. We've broken the whole thing down into 5 key stages, from the prep work right through to heading home.
Okay, let's dive into our first section, the preparation. What happens here really sets the stage for everything that follows.
So long before any procedure, the medical team is basically doing detective work. They're assessing all these key risk factors, things like your age, nutrition, whether you smoke. It all plays a part in how well you heal. But take a look at the one that's highlighted: obstructive sleep apnea, or OSA. It might seem a little out of place, right? Trust me, it is a huge piece of the safety puzzle. We'll see exactly why in a little bit.
And here's one of the absolute most important steps: informed consent. You, the patient, have to give your permission with a totally clear mind before they give you any kind of sedative. It's a critical safeguard. It ensures you are fully in the loop and understand all the risks and benefits.
All right, prep is done. Now we head into the operating room itself. This is what we call the intraoperative phase, and it's where all that careful preparation really pays off. Anesthesia isn't just a one-size-fits-all thing. It's actually carefully tailored to you and your specific procedure. It can be anything from general anesthesia, where you're completely unconscious, all the way down to a simple local anesthetic that just numbs one tiny little spot.
So, once the surgery is over, you move into the first phase of recovery. And let me tell you, this is a really critical window. The team is watching you like a hawk as you start to wake up. Their focus is 100% on the ABCs, making sure you have a clear airway, that your breathing is steady, and that your circulation is stable.
Have you ever wondered why so many patients are on oxygen after surgery? Well, it helps to look at the air that we're all breathing right now. It's mostly nitrogen. Only about 21% of it is the oxygen our body actually uses. And for a body that's working overtime to heal, that's often just not enough to get the job done right.
And this is how the medical team can give your body that extra boost it needs. They can precisely control how much oxygen you get. A nasal cannula, those little prongs in your nose, gives you a gentle boost. But for patients who really need help, a non-rebreather mask can deliver air that's up to 90% pure oxygen.
Okay, remember how we highlighted obstructive sleep apnea earlier? Well, this is the payoff. This is why it matters so much. For patients with OSA, their airway has a tendency to collapse when they're asleep, and after anesthesia, that risk is way, way higher. So that screening they did beforehand, it is absolutely critical for keeping the patient safe during this really vulnerable recovery time.
Now let's talk about something that is extremely rare, but it's something every single surgical team is trained and prepared for. It's called malignant hyperthermia. It's this life-threatening genetic reaction to certain anesthetics, and it requires perfect, immediate action to prevent a total catastrophe.
The response has to be so fast and so precise that they actually drill it into teams using this really memorable mnemonic: some hot dude better give iced fluids fast. It sounds pretty funny, but each word corresponds to a critical life-saving step. You stop the agent, hyperventilate with oxygen, give dantrolene, that's the antidote, begin cooling, give IV fluids fast. It is a frantic race against the clock.
So, once the immediate risks from surgery are managed, a whole new battle begins. This one is about protecting the body from infection while it's in such a vulnerable state.
Pretty much any infection, whether it's a simple cold or something more serious, follows a predictable path. It starts with this silent incubation period. Then it moves into that stage where you just feel kind of off. That's the prodromal stage. Then, bam, you're in the peak illness phase before your body finally starts to fight back and you begin to recover.
To stop an infection, you have to understand how it spreads. The best way to think about it is like a chain with 6 links. For an infection to actually happen, all 6 of those links have to be connected. But here's the amazing part. If you can break just one of those links, you stop the whole process dead in its tracks.
So what's the single most effective way to break that chain? It's not some fancy new drug or a high-tech machine. It's simple, consistent, thorough hand hygiene. That's it. It is the #1 way to protect patients, caregivers, and of course yourself. All right, we're in the final stage of our journey now. The focus shifts to getting you home. But the care definitely doesn't stop just because you've walked out the hospital doors.
If a patient goes home with oxygen, safety is everything. These rules are completely non-negotiable. See, oxygen itself isn't flammable, but it makes other things burn much hotter and faster. So simple things, like not using petroleum-based lip balm or making sure tanks are secured, can literally prevent a terrible accident.
And finally, let's talk about pain management. This is so important. A patient's report of pain has to be treated as a real and valid symptom. I mean, acute pain after surgery isn't just possible, it's expected. And every single patient, no matter their background or their history, deserves to have that pain managed effectively so their body can actually heal the way it's supposed to.
You know, when you really think about it all, from all that careful planning before, to the body's own incredible power to repair itself cell by cell, the entire surgical journey is just a testament to our resilience. It's this remarkable collaboration between medical science and our own bodies, all working together to become whole again. It's pretty amazing.